Welcome back, everyone. Well, it's a topic that not many people like to talk about, but it's one of the most important things that you should actually know about. Dr. Christopher Maxwell, good morning. How are you?
Morning, Troy.
And you're from
Great,
Utah Gastro. And of course, we're going to be talking about diverticulitis disease.
Yeah.
Diverticular
disease. Yes.
What is it? Let's go.
Right. So
because when I read it, I was like, what the?
Right. So diverticular disease is a problem in the colon, and nobody really likes to talk about problems in the colon, but they're really, really common. So as much as 60% of us are going to get diverticular disease at some point in our lives. And diverticular disease refers to pockets that form off of our colon, and it can be a problem because they can become infected and make us very sick, or they can bleed.
Okay, what is the cause of this?
So we're not exactly sure. We think a lot of it is genetic. You get it probably because your parents had it. But then in addition to that, we don't think people used to have as much diverticular disease as they do now. So it's much more common today than it used to be.
It's funny you say that, because we were talking in the break and I said, is diet affected? And you went, yes.
Yeah, so we know that diets that are high in fat and red meat, unfortunately, make this much more common. And we know that vegetarians are very unlikely to get diverticular
And
disease.
this is not just about men and women, everyone. This is equal.
Equal.
Really.
Yeah, about the same.
And not from 50 plus. It is all ages. All ages can have this
Everybody
problem.
can get it. We start to see it, we can see it in all ages. It certainly gets more common as we get older, and the complications of it are more likely as we get older as well.
I wanted to ask you, what are the signs? How do we know we have it?
So diverticular disease usually is asymptomatic. There are no signs. So we get these pockets that form in our colon as we get older, and usually there aren't signs until there's a problem. And the two big problems are diverticulitis, when it becomes infected, and diverticular bleeding, which would show up as bleeding.
Okay, and I was saying to you that kids would come and tell you, mum and dad, straight away, but adults leave it for way too long.
Right, so a parallel to this would be when a kid might have appendicitis and they get very sick, and kids are, you know, parents keep a close eye on their kids and they say, wow, my kid isn't eating, they have horrible belly pain, they're laying down, they have a fever, they're very sick. But a lot of adults are a little more stoic. They put off those symptoms, and they try to just kind of work through it.
Well, you know, I'd be in there in 2 seconds. I'm a weakling when it comes to a bit of pain. I wanted to ask you, when we come into the clinic to actually have it diagnosed, if you think there's something wrong, is it done by x-ray? How is it all done?
So you can start with diagnosing it with symptoms often, and if it gets bad, then we might do a CT scan or an x-ray. Most diverticulitis cases can be treated with just antibiotics in the outpatient setting, and about 15% require going into the hospital for more serious treatment, and some need surgery to fix it.
Right, and it's done through the colon, so with a colonoscopy
procedure? So you can diagnose it with a colonoscopy. Usually it would be diagnosed with x-rays and with symptoms, you know, an exam. And then after you recover from your diverticulitis, maybe 6 weeks later, you need a colonoscopy to make sure there isn't anything funny going on.
Untoward in there. And when that's done, is that all done part of through healthcare insurance?
Yeah.
So there's no cost really for you?
Well, you know, our insurance system's a bit of a mess.
Yeah, I understand that.
But no, it is usually covered as
this is something
necessary.
That I think that's really important, not only after the procedures done as such, or the determination of what you have, and you go back in 6 weeks later and maybe have a colonoscopy. Right. Having the colonoscopy can also see some other things that could be wrong as well. So
it does. So we know that on colonoscopy done for diverticular, we know that something like 30 or 40% of patients find polyps as well. A small percentage of patients we find other bad things that could have caused this disease that we think is diverticulitis, cancer or otherwise.
Does this symptom actually cause anything else if it's not diagnosed properly and treated? Like, does it cause cancer? Does it erupt in any way? We
think that there may be some association with cancer, but that's not really fleshed out well. We know that once you get an episode of diverticulitis, about a third of people get all better and never have problems again. A third of people kind of smolder on with little bits of pain in that area, and then a third of people go on and have another bad episode of diverticulitis again.
Wow.
Yeah.
Well, it can be, you know, as long as you go and actually have it checked out, things are quite okay.
Yeah,
it's not anything too bad.
No, it's very
but it's
treatable.
just being diagnosed.
Yeah, it's
properly.
very, very treatable.
I appreciate you coming in, Dr. Christopher Maxwell. If you want to find out more information about Utah Gastroenterology, head over to our website at www.forutah.com/GTU, and we will link you to all their information. It's pretty interesting and something that we should all have checked out as well. Yeah. Glenn?